Okay, let's go over to the United Kingdom and get the latest coronavirus situation there. Joining us live from the UK, we have Graham Thomas. Hello, Graham.
Good afternoon, Alma, or good evening.
Good afternoon over there, good
from the
evening over
United
here. Yes. How are you doing, Graham?
We're okay, thank you. How are you all doing there?
I'm doing great. Thank you for asking. What are your updates for
It's
us?
good to hear. Okay, well, here in the United Kingdom, our Prime Minister has started returning to work as virus criticism now starts to grow. British Prime Minister Boris Johnson tentatively began his return to work on Tuesday after being hospitalized for coronavirus as Parliament returned and criticism grew over the government's response to the outbreak. Johnson spoke on the phone to US President Donald Trump about the international response to COVID-19, and officials said he would speak to our Queen Elizabeth II, in the coming days for the first time in some 3 weeks. However, his spokesman said the 55-year-old who spent several days in intensive care was not yet formally doing government work, as he recuperated as his official countryside retreat of Chequers. So Foreign Secretary Dominic Raab remains in temporary charge and took Prime Minister's questions today during a semi-virtual session of the House of Commons. As MPs returned yesterday from their Easter break, they immediately approved new measures to allow the vast majority of the 650-seat House to stay away. Social distancing means that only 50 MPs can attend safely, and Commons Speaker Lindsay Hoyle has instead asked MPs to dial in via Zoom, an internet video conferencing service. Hoyle said it is a historic moment for the 700-year-old Parliament, adding, in times of crisis, we must find new ways of working. Many MPs have been keen to get back to work amid growing questions and criticism about the government's response to the coronavirus outbreak. Britain is currently one of the worst hit countries in the pandemic, with 17,337 deaths in hospital, according to yesterday's figures, an increase on 828 on the previous day. Raab last week announced that a nationwide lockdown requiring people to stay indoors would continue for another 3 weeks. But debate is growing about how the measures might be eased, with questions about its economic impact. Jonathan Van Tam, England's Deputy Chief Medical Officer, said on Tuesday the outbreak had peaked in London, but the picture was far more mixed for the rest of the country. We remain in a situation of danger that we must take very seriously indeed, he told the government's daily media briefing. The Health Ministry currently only gives details for deaths of people in hospital who have tested positive for the virus, but there have been repeated concerns about underreporting, as deaths outside hospital, particularly in care homes, have not been included. In its weekly bulletin, the Office for National Statistics said 18,516 deaths were registered in the 7 days to April the 10th. This is some 7,996 more than the 5-year average and the highest weekly total since the start of January 2000. A total of 6,213, or 33.6%, mentioned COVID-19, including the suspected cases on the death certificate, which is up 3,475, or just over 20% on the previous week. Martin Hibbard, Professor of Emerging Infectious Disease at the London School of Hygiene and Tropical Medicine, said, without widespread testing, the increase in deaths may be directly linked to COVID-19. But it's also likely that at least some of these were indirectly involved, such as through inability to access typical medical care for other conditions because of the COVID-19 activities, he said. Alma.
Okay. Also, there was a A report, according to the ONS, the number of deaths in care homes has doubled in just 4 weeks.
Yeah.
Sounds alarming.
Yes, it is. It's doubled in the last 4 weeks, but also doubled again in the last 7 days, according to reports that we heard today. So the overall figure is now thought to be around 2,000 in England, up to April 15. So they were the latest figures that were released earlier on today.
Graham, you own a care home, don't you?
I do, Alma, yes.
What are the challenges are you facing right now, owning a care home and with this crisis around us?
I think for us here, now that we're starting to hear of the deaths in the care homes, it's about making sure that our staff are safe. We're very fortunate in the ones that I own in that we don't have any identified COVID-19 at the moment.
Very good.
So, yeah, we're very, very happy to report that at the moment. And we're not having problems with our PPE or protective equipment at the moment. But I think that's in the main because we're not having to use that many because we haven't got recognized COVID-19 in the care home. But I know in many care homes where we are here in the UK, they are starting to run out of PPE. So that's a big concern at the moment.
So if care homes are running out of PPEs, what more with your health workers over there? I mean, the last time I talked to you, I think there were already problems with the PPEs of healthcare workers, but now has it improved or it hasn't?
I think it's quite sporadic across the UK. In London, for example, in the major cities, they are still experiencing some problems. But in the more rural areas, such as where I am in Bournemouth in the south coast, the local hospitals here have said that the rumours that they haven't got PPE is untrue. They do have enough PPE to cover their needs. So I think in the major cities, we're still having problems. But as you know, we had a delivery from Turkey arrive today. So it'll be interesting to see how they get distributed.
How do you keep yourself positive when all of around us is under this coronavirus situation? Can you give us some tips, our viewers?
I think you have to just keep safe yourself. You have to look after yourself and look after those around you in your immediate household, your immediate family. And do the things that we're being told to do, so social distancing and not going out for unnecessary trips. I'm fortunate in a way that I have to go to work, in that I'm not having to stay in the house, which I know can be slightly tedious, especially as we're getting warmer weather now. So, you know, for me, work has become a bit of a godsend, even though we are in the middle of this pandemic. But I'm encouraged to see how the UK is responding socially to this pandemic. You know, we're starting to see people look out for each other. We're starting to see people appreciate the time that they have with their family and appreciate the roles that people play in society. So those are really positive things, and I'm really hoping that even after this pandemic and we're out the other side, which I'm sure we will be, that these characteristics of the UK will become more inbred, so that we'll see more of this as we move forward.
All right. Thank you very much, Thomas. Thank you. Keep safe, stay healthy, and stay positive. Thank you for your time.
Thank you. I'm Graham Thomas from the United Kingdom for EBC, and we certainly do live in interesting times.